So we know that millions of Americans have diabetes, and it's a more than $50 billion business in terms of drug revenue alone. But we are learning about some new ways of tackling the disease. Take a look.
Rita Perkins has lost more than half her body weight. By walking more, she lost 100 pounds, but the scales stuck there as she couldn't kick unhealthy habits, and Perkins struggled to control her diabetes. Then she received a different kind of prescription.
We're standing in the fresh food pharmacy at Geisinger Shamokin Hospital.
A prescription for fresh, healthy food.
Oh, hi, Rita.
Hi, Anna.
Hi, come on in.
Perkins is part of a new program at Geisinger Health System designed to control type 2 diabetes in low-income patients. Not with more medicine, but with food and education.
In healthcare, we spend an awful lot on drugs and devices because it's business, but we spend a very small amount on preventive medicine. It's sort of like we're upside down and backwards.
Well, I guess I better get some peaches.
The program has resulted in dramatic improvements in patients' health, from cholesterol to weight loss to blood sugar. Some have been able to reduce use of diabetes medicines, and it saves money too.
Financially, we've seen probably a decrease in healthcare claims paid out on our Geisinger patients by over 2/3.
This is the plate I used to eat on. Now I am down to this size of a plate.
Perkins receives 10 free meals a week for everyone in her household. She says the program helped her drop another 45 pounds, and it's also setting a new path for her family.
I know they're learning to eat the healthier way than what I was.
And later today on Modern Medicine, we dig into a Silicon Valley startup that's trying to make a business model of trying to help people improve their diets. It's a really interesting case study. And for Geisinger, which of course is a health system, they're getting tons of inquiries about how to replicate this system around the country.
I mean, it's kind of amazing to see a healthcare provider putting kind of its money where its mouth is and seeing these things play out like
Yeah, that's what Rita Perkins told us. She was like, I've never heard of a hospital doing this kind of thing. They're giving free food, and that's kind of how they're thinking about
and also
medicine.
lessons along the way. It's
Absolutely.
Probably lessons we could all use from time to time.
Lots of education, yeah.
Hey there, thanks for checking out CNBC on YouTube. Be sure to subscribe to stay up to date on all of the day's biggest stories. You can also click on any of the videos around me to watch the latest from CNBC. Thanks for watching.